time for a new and exciting program sponsored by the Smile Studio. Dr. Mal Braverman will be answering your questions on all phases of cosmetic and reconstructive dentistry.
Hi, everybody. This is Bill Monahan with Dr. Mal Braverman, and the big question, as we have always asked, is have you ever wished you had a movie star smile? Well, it's possible. You don't have to be a model or an actor to look like one, you know. Dr. Mal Braverman will be hosting Smile Studio tonight, as he always does. Now, Dr. Braverman is one of the leading cosmetic dentists in New York City. Dr. Braverman has created winning smiles for New York models, TV, and movie personalities, as well as for people like you and me. He is co-founder and president-elect of the New York chapter of the American Academy of Cosmetic Dentistry. Dr. Braverman organizes professional meetings for other dentists interested in the latest techniques in cosmetic dentistry. Now, Dr. Braverman will be answering your questions on all phases of cosmetic and reconstructive dentistry. If you're not happy with your smile and have spaces, chipped, crooked, or discolored teeth, you may be interested in porcelain laminate veneers. A smile makeover in just 2 simple visits. It's true. An impression is taken at the first visit. Porcelain covers are made for your front teeth, correcting all imperfections, and bonded on the second visit. In 1 week, you have a perfect smile. You can also whiten discolored teeth at home while you sleep in just 1 week. So without further ado, here he is, everybody, Dr. Mal Braverman. Good evening, Dr. Braverman.
Hi, Bill.
How you doing?
Hi, New York. We're going to talk about teeth tonight.
Terrific.
We're going to talk about, are you a candidate for cosmetic dentistry?
Now, some people might not even realize they might be candidates, right?
Right. I mean, are you the kind of person who smiles openly, who has the confidence of smiling and knowing that you're putting your best foot forward and looking your very best? Or are you self-conscious about your smile? Do you tend to raise your hand, or do you tend and cover your smile?
Mm-hmm.
Do you tend not to smile at all, even though you're happy?
Right.
And people accuse you of not smiling when maybe you're really just self-conscious about your teeth. And there's lots of things that can cause somebody to legitimately not smile.
Right. A smile says a lot, though, don't you think?
Absolutely. I mean, people will do anything to enhance their appearance. They'll spend a fortune on clothing and jewelry, perfume, makeup for women.
That's true.
And they forget the essentials of those natural resources, like a beautiful smile. Just like if you go out and have all the clothes in the world, if you would lose 15 pounds, everything looks good on you.
Right,
you know?
It's true.
And when you're overweight, nothing looks good on you. I don't care if it's Armani.
You're absolutely
it's
correct.
just not going to work, right? Nothing works like the natural smile, like losing some weight if you need to, a little discipline. And so it takes a little discipline to take care of yourself, to go out and do something good for yourself for a change, and give yourself a treat. Give yourself a new smile. It can start as simply as just whitening your teeth. Ask yourself if you would like whiter teeth.
Right.
Are you unhappy that your teeth have yellowed with age or worn with age? Or when you smile, perhaps those people have a very gummy smile. You know, when the gums grow down over the teeth.
Right. More gum than teeth.
These are people who are candidates for cosmetic dentistry. If there are spaces between your teeth, or they're too short, or they stick out, or they're twisted, all of these things can be changed in a heartbeat with porcelain veneers. But that's not the only solution. We can reshape teeth by just reshaping them. If they're a little too long or a little too wide, we can taper them, we can shorten them. That's called cosmetic contouring. Whitening, obviously, we know about that. We've talked about that. A lot of people are aware of it. You wear this night guard. You sleep with it. You put a gel in there. It's sort of like what boxers or athletic guards, a football guard. It's a clear plastic tray that's made custom fit to your mouth, and you wear this gel overnight. And just overnight, your teeth whiten by this oxidizing gel taking out stain that has penetrated into your teeth. So whitening is very simple. Reshaping your teeth is simple. Minor tooth movement, just closing spaces or bringing teeth in that stick out, or twisted teeth, turning them a little bit.
Wow.
So gradually, little and little, there are lots of different ways. Bonding is the ability to just add tooth-colored material to a tooth where you have a space, or let's say you have that space in the front of your front two teeth.
Right.
You could put a little bonding material on each side of each tooth, closing
Right.
that space. Or the absolute Rolls Royce of smile makeovers, those are porcelain veneers. You can take all imperfections in your mouth, whether it's discoloration or chips or worn or etc., and you can make these porcelain covers, bond them on, and just have the perfect smile, just like that.
Now, what if
But-
people have gold crowns already? Can you do something with, or do you have to remove the gold crown?
Well, crowns today can be very aesthetically made in all porcelain. So we don't, and in the old days, they were gold, or they were porcelain over gold, or they were plastic over gold.
Right.
You had to have a metal understructure to the crown. Today, we can make an all porcelain crown and give it the strength of bonding to the tooth and the aesthetics that you get from all porcelain that you cannot get when you try to have porcelain mask out metal underneath. That's why you see that black line around some crowns. And that certainly is something that we can do.
Tonight we're talking about candidates for
Cosmetic dentistry.
cosmetic
Sure.
dentistry and makeovers. I was going to say makeovers, but
Well, I guess we've covered that very well. Why don't we go to the phones, see if we have any questions?
also I'd like to give out the phone number. Is the free consultation, is that still going on?
Oh, absolutely.
Okay, so if you want to, here's a chance to get a free consultation. They say, gosh, I'm not sure if I can afford. Get in there. You have a free consultation. It's at his penthouse office at 30 Central Park South. What's that, between 5th and 6th?
5th and 6th on
Okay.
59th. And
Okay.
we love to do that.
You do. And
It's a
you-
chance for people to meet us, see what our practice is all about,
Right.
see some before and after pictures of patients that we've treated, review our credentials. We have a video of a TV interview I did where I cover a lot of the procedures that we've just talked about.
And as
And,
you're talking about it, do they see how people's teeth are being
Absolutely.
reconstructed?
Yeah,
or-
absolutely.
Mm.
Yeah, it's a great visit for somebody who's serious about making a change in their smile. And we like to make it
Right.
without any qualification, make it easy for people who would like to find out about this kind
I've
of
been
work.
there once, and I tell you, and this is for everybody, it's very comfortable. You know, like when we were kids, we were going to the dentist office, and you always had that sort of smell and that look of a dentistry. It's a very warm kind of, because there's that
Thanks,
big
Bill.
glasses. I mean, the big glass
the view of the
looks
park.
out over
You're
Central
going to
Park.
scare everybody. They're going to think we're too expensive. But
No, he's not. Let me give you that number, though. Write it down. Put it near the phone, 212-688-3838, 688-3838. Write it down. You've got a free consultation. Call the doctor. Call him tomorrow, but call him soon, all right? 212-688-3838, and that's at 30 Central Park South. When you call him, if you want some directions, certainly give him a call. I'm on line 1 here. Hi, welcome to Smile Studio.
Thank you.
Hi, Mary.
Hello, how are you?
You're on with Dr. Mal Braverman. Go right ahead.
Dr. Braverman, I've had gum surgery and I have a lot of recession. It's caused 2 problems. It's quite ugly and also I have a lot of sensitivity. Could this be bonded?
that's a great question, Mary. The sensitivity comes, let me back up and talk about sensitivity a while. The crown of your tooth is covered by enamel, and that's what prevents it from being sensitive to hot and cold and sweets and things like that. When you have the surgery for, and I'll explain to the audience what gum surgery does, is you have some bone loss around the roots of your teeth, and pockets develop in the gum. That becomes infected in that pocket, and surgery accomplishes 2 purposes. It removes inflamed, infected tissue, gum tissue, and it also corrects the shape of the bone. It gives you a new, healthy start. Unfortunately, it leaves your roots exposed. They don't look good, and they're sensitive. So, to hot and cold and sweets and things like that. Well, full mouth reconstruction is one solution, and that's to make crowns that cover the roots in the crown and restore the correct contour into the gum. And that's the old traditional way to deal with that kind of situation. However, today we have lots more solutions.
Mm-hmm.
We have porcelain veneers which cover exposed roots and prevent them from being sensitive. We have bonding which covers exposed roots. If it's not circumferential around the tooth, if it's just on the labial surface or the facial surface, we could just put a veneer there, we could bond it. we can actually use the resins that we prepare the tooth with before we bond or put veneers on to seal off the dentin from sensitivity. Fluoride prevents sensitivity. We do fluoride treatments. And in our office, we try to avoid, Mary, I wish you would have called sooner, the surgery. We like to do soft tissue management where we keep the gum tissue. We do not do surgery. And if anybody is contemplating surgery or worry about their gums, give us a call or come in for consultation. We may be able to avoid that for you with what we call soft tissue management. And that means cleaning out that pocket of infected tissue around the gum and still keeping the gum tissue so you don't have those sensitivity and aesthetic concerns after the surgery.
Let me give you that number, Mary. It's 212-688-3838, and this is a great opportunity because there's free consultation. 212-688-3838, 212-688-3838. We're going to be back with more with Dr. Mal Braverman in Smile Studio in just a moment or so.
If you're not happy with your smile or have spaced, chipped, crooked, worn, or discolored teeth, you may be interested in porcelain laminate veneers, a smile makeover in 2 simple visits. An impression is taken at the first visit. Porcelain covers are made for the front of your teeth, correcting all imperfections, and are bonded on a second visit. In 1 week, you have a perfect smile. You can also whiten discolored teeth at home, a simple process customized for you while you sleep in just 1 week. So tune in to Dr. Mal Braverman and Smile Studio, or call Dr. Mal Braverman at Smile Studio, 212-688-3838, to take advantage of a free consultation at his penthouse office at 30 Central Park South. That's 212-688-3838.
Welcome back, everybody, to Smile Studio with Dr. Mal Braverman. I'm Bill Monahan. Now, we started off talking about candidates for cosmetic surgery, but there's a lot of people, of course, with folks down there in Wall Street, and, of course, we're talking about New York, so smiles and...
Well, we were talking at dinner.
Right.
That's right, about, you had mentioned, do you think that some of your patients remark with regard to work? Has the smile improvement helped them in work?
Right. Do they ever come in? First of all, do they ever come in and say, I give this great presentation, I spent all this time, and yet people's response to me was not very positive. And then
I'm going to tell you, they get work. I mean, and you know who gets work? I'll tell you, actors get work, and models get work. I had a woman come to me who said, I'm really serious about my acting career. I want to be as good as I can be. I want to look great. What can you do for my teeth? I looked at her. She had great teeth. But you know what? Her mental attitude that she wanted to change, we whitened her teeth. We recontoured them a little bit. It did not take a tremendous change. She's a gorgeous woman anyway. She's on a soap now. She's got commercials for toothpaste commercials.
Really?
You see her every 3 minutes on another commercial. And right in the middle of that commercial is this gorgeous smile on this woman.
Isn't that something?
And maybe she's listening to this show and she'll call in and talk about it. But you never know. I've seen a smile do so much for people in the past. There was a time that I worked in the community, and people who could not afford dentistry at all, who had dental problems, were self-conscious, missing teeth.
Right.
I mean, some serious problems. I mean, when you don't have a nice smile, you not only can't get a job, you can't get a date, you can't get a job. I mean, it affects every area of your life.
Right.
I mean, you can't eat, you're in pain. You can't get a date, you can't get a job, you can't work, you can't have a social life, you can't enjoy a meal, and you feel poor. Well, there's not a real big difference from a lot of people who are very affluent and could do something about this and improve their position at work, get a better job, move up the ladder. And we've seen it a million times in our office. People, whether their own self-esteem increases enough to make them just be out there, or whether the actual smile does it itself, I can't tell you. I tend to think probably it's the former. I think it's that feeling of self-esteem that somebody gets when they're confident, when they know they look good. And the rest is just magic.
Well, a smile does communicate some very interesting things, and you just said it just a moment ago, and that was confidence.
confidence is the answer.
Absolutely. If you have a question for Dr. Braverman, we do have a couple of lines open, everybody. If you have problems with your teeth, and let's say they're crooked, they're chipped, and you think, oh, no one can do anything for these, give Dr. Braverman a call. We're here, of course, live. We have, like I say, a couple of lines open, and we'll be taking your calls. And, of course, his office number, if you're a little embarrassed, and you shouldn't be, to get on the air, 212-688-3838. 212-688-3838. And like I said, we do have a couple of lines open if you want to ask Dr. Braverman a question tonight on Smile Studio.
I wanted to talk about sensitivity, since Mary called before.
Right.
This is something interesting for people, I think, to understand. Everybody knows when they're, sometimes they'll get a sensitivity in a tooth from sweets or hot or cold or pressure or biting or percussion. What does all that mean? It's just an interesting diagnostic tips from a dentist's viewpoint.
Mm-hmm.
Sweets usually means that you have a cavity or a leaky filling or leakage around a crown or a dental restoration. Also sensitive to cold would be similar. Root sensitivity could cause cold and hot and cold, and that's when you get erosion along the gum line. When you have recession of the gums, and you get a little erosion of the root, it's not covered by enamel. That's gum line sensitivity. The gum line sensitivity, and if you have a root canal problem, a dead nerve in a tooth, that'll be sensitive to percussion. And if you have gum problems, that'll be sensitive to pressure. So if you have sensitivity on chewing, very often that could be bad gums. If you feel sharp pain when you bite something, that could be a root canal problem. Or when the nerve in the tooth itself dies and becomes pus, basically, and ends up at the tip of the root with a little infection. So it's transmitted through percussion to that pressure at the tip of the root. These are just, some diagnostic tips for patients. But we can do a lot of things about sensitivity.
Excellent. Like I say, we do have a couple of lines open, everybody.
Let's go to question?
Let's go to Beverly here in Manhattan. And Beverly, welcome to Smile Studio with Dr. Braverman. You have a question?
Yes, I do. Thank
you. Go right ahead.
Hi, Beverly.
I had a bridge put into my mouth, and after it was cemented in permanently, the dentist discovered what he called resorption. There was a hole in the anchoring, one of the anchoring teeth that was beneath the gum line, and they had to break the bridge, and I had to have a root canal. And now they're telling me I should have periodontal surgery to cut the gum beneath where the hole is, and fill that, so the dentist can fill that, and then they can try to create a new bridge. And I wonder what you think of this, of the possible success of doing this.
Oh, good question.
Well, dentistry gets complicated sometimes. If you had a bridge and it was well done and it was well sealed on the tops of the teeth and the crowns, and you did in fact just get some resorption lower down on the root, it would explain your story. Resorption, you might need to treat that cavity which is below your bridge by doing some surgery to get to it and restoring it. It also sounds like it could possibly be a cover-up for a bridge that wasn't made well. And it would be very hard to say without seeing you. Certainly, I would be glad to take a look at you if you would like to come into the office. It's a hard thing to assess on the telephone.
Right.
It could be totally legitimate what you're saying, or it could just be a little bit of a fudge factor on the bridge. Or
2 weeks after it was permanently cemented, they discovered this cavity, and I had already paid for 2/3 of the bridge, and I can't get a refund now. And I've gone to these dentists for many years, and the dentist offered to create a new bridge and not charge for his labor. So
that sounds very fair.
I don't think it was intentional.
Right, I see. So that's a good indication, and that should make you feel better. Perhaps, it was something that erosion doesn't happen that fast. Maybe it's something they missed the first time around.
Well, I can't understand.
But albeit sometimes, the x-ray doesn't show it until you get a certain angle. And as long as he's willing to do it again and do it properly, that's very good.
Well, they have to do this extensive perio surgery now.
Well, the thing is, with resorption, it's on the roots. Crowns are usually made on the crown or the enamel of the tooth. And the reason they have to do that, the surgery, is so that they can get deeper down along the root to get to the decay.
Right.
So it actually sounds pretty feasible. And does that answer your question?
Yeah.
Okay.
Did that answer it?
Yes, thank you very much.
Okay, Beverly, good luck.
Okay, and certainly if you have other questions, you can call them at 212-688-3838, 212-688-3838, and, take advantage of a free consultation at his penthouse office, everybody. 30 Central Park South by calling, and here's the number again, 212-688-3838. That's 212-688-3838. And Dr. Mal Braverman at Smile Studio. Thank you so very much. It just flies by.
Don't know where the time goes.
It just
flies, doesn't it?
It certainly does. Thank you very much.
Well, thank you, New York, for listening, and tune in next week. Bye-bye.
Bye-bye.